Hello, I'm Dr. Andrew Neville, and I specialize in treating adrenal fatigue. And a lot of my patients are also diagnosed with POTS, something called POTS, or otherwise known as dysautonomia. POTS is postural orthostatic tachycardia syndrome. These are essentially in a category of dysfunctions that we refer to as orthostatic intolerance. And whether you call it POTS, which is where your heart rate goes up, if you stand up too quick and your heart rate goes up more than 10, 20, 30 points, we can call it POTS. Or sometimes it's called neurally mediated hypotension, which is a bit of a slightly different scenario. But what all these are, these orthostatic intolerance issues, they fall under the category of dysautonomia. That dysautonomia refers to your autonomic nervous system, okay, which is the part of your nervous system that controls stuff you don't have to think about. It's basically all the nerves that go to all your organs, right? Speed up the heart, slow down the heart, all that stuff, right? Dysautonomia is a dysfunction, right, or a problematic autonomic nervous system, right? And when the autonomic nervous system becomes dysfunctional because of stress over time and overuse of this system, it causes a variety of symptoms. Sometimes it's this lightheadedness or palpitations when you stand up over time, right? But your autonomic nervous system controls a bunch of other stuff, right? It controls your respiratory rate. So a lot of my patients have like a shortness of breath or like an air hunger kind of a situation. This autonomic nervous system controls whether you sweat or not, your pupils dilating or not. It basically controls your entire physiology, and our physiology kind of exists in this balance, at least it should. With patients who've developed adrenal fatigue as a result of chronic stress over time, okay, that autonomic nervous system has been overworked, right? And it gets trigger happy. So when we have to use it to balance our physiology, it just becomes dysfunctional. So the dysautonomia is absolutely accurate, but I would suggest that dysautonomia is caused by a dysfunction in your whole stress response system. And focusing just on the autonomics isn't necessarily going to give you tremendous success. But when you focus on the hormone side of your stress response, including the adrenals, the nerve side of your stress response, yes, the autonomics, but also the CEO of your stress response, which is that limbic system in the brain. When you focus on all three of those pieces of your stress response system, that autonomic nervous system finally has a chance of balancing out and recovering its kind of nuanced, dynamic responsiveness that it once had way back when. So don't get too caught up in the dysautonomia POTS kind of a thing. Yes, it's something we pay some attention to for sure, but we have to treat this mechanism as a whole, the system as a whole, and that's when your physiology shifts and that dysautonomia can improve over time. Good luck.